Hi, welcome back to the Mountain Morning Show. I'm very excited to be interviewing my friend Allison Page about Trail Talk. Welcome, Allison.
Thank you. Thank you for having me. I appreciate that.
Yes, so Trail Talk, that's a little bit of a different concept for mental health. And tell us a little bit about your background, and then we'll get to why you started Trail Talk.
Okay. Well, I've been a nurse since 1980, graduated from the University of Maine in Portland, Maine, and headed west and forgot to go home. And once I got here, I realized that there was just so many nursing opportunities. I originally thought I was going to go back to Maine and be a midwife in the northern woods of Maine, and I ended up in Newburn ICU at Primary Children's, and I thought, I'm never going to do that. But then as I moved into the ICU setting, which all new nurses tend to think they need to do that, I realized I was a really community-based nurse, and went back to grad school soon after and got my first master's in pediatric nursing in '85, and followed that career. I've been in the nonprofit world my entire nursing career, and then moved into starting Trail Talk after my kids went away to college. I decided, I took some years out of the workforce, kept my licenses current, traveled a lot with Hope Alliance, a local nonprofit, as a nurse, and with my children. And then when they went away to college, I decided I'd go back to grad school because I could do school well, and I thought, you know, what am I going to do in my next nursing career? So I got my master's in family psychiatric nursing. That was my quickest way to get into the opportunity to become a therapist. Okay. And so during grad school, I'd never been more stressed out in my life. And I went out on the trail with my dog, as everybody does in Park City, and I find great solace and comfort walking in nature. And as I was out there, I just had this epiphany. It's like, oh my gosh, this is what grounds me. I just need this. And then a light bulb went off, and I'm like, I'm going to do this with my clients. And I snowshoed home and looked up walk and talk therapy, and that journey started. I started trademarking the heck out of it, thinking I'm going to do Trail Talk. We're going to take therapy off the couch and onto the trail. We're going to normalize emotional care for active functional folks and switch that paradigm, as we were talking earlier, from a mental illness model to a mental wellness model.
I love that.
Yeah.
Instead of even just mental health, mental wellness.
Absolutely, because as you know, being a mother and a career woman, and you wear many hats, and many of us do, women and men, and we move in and out of mental wellness. So when our stressors overwhelm our coping capacity, we fall out of our best self, we fall off balance. And so there's nothing wrong with that. Are we sick? Sure, we get viruses, we get colds. We go through that with our mental wellness as well. And so there's something called emotional parity, lending emotional parity. And it's been on the docket for years with people trying to destigmatize emotional care. And the niche demographic that I'm going after are people like us in Park City and in other communities where we're highly functional people, but boy, there's something going on. Our relationships are falling apart. There's some disparity between how much emphasis we put on our professional selves and our physical selves, but we don't lend the same parity to our emotional care. And that's where Trail Talk comes in. We offer emotional tune-ups.
I love that, emotional tune-ups, because we all need that. I mean, that's just like going to the doctor for your wellness visit and getting your physical, and they look at your blood pressure and they look at your cholesterol.
Right.
So
it's preventive health care. And we need to do
wonderful.
that with our emotional care too. There's not, you know, when some people come to see me or they say, oh, I don't need emotional care, it's like, well, you're either lying or you came from a really boring family. Because you know, that's what makes life rich, is the some of the weirdness and the interesting relationship dynamics within families.
Well, and I love how you say move your body to clear your mind. So you said you did that with your dog when you were in your stressful situation of grad school. What would be some other clients? I mean, of course, we don't want to confidentiality. We don't want to do that. But what would you do? I mean, just give us an example of what it looks like.
So the whole idea of Trail Talk is that we're using nature as our therapeutic milieu or a therapeutic backdrop.
Okay.
As a nurse, I'm really looking at combining nursing theory with wilderness therapy. So for the last 5 years, I've been aligning myself with the wilderness therapy community to show that we can use nature as our therapeutic backdrop in mainstream private practice. But as a healthcare provider, I need to be evidence-based, and so I've been collecting data called OQ. It's called Outcome Questionnaire, and it's the same it's the same measurement tool that the wilderness community uses. There's
that's
a group
great.
called the Outdoor Behavioral Health Consortium, and so I want to show that Trail Talk is impactful for everybody. Why should wayward teens have all the fun? And I mean, it's not about exercise, replacing exercise. It's about being out in the sun, moving your body slowly, bilateral stimulation, and allowing for intermittent eye contact. Some people think therapy is still Freudian, that you'll lay on a couch because they've never done it before.
Yes.
You know, they say, you know, I'd like to talk to a professional, but boy, I don't know, going into an office is weird, and maybe if my wife finds out, she's going to say, see, I knew you were crazy. Or if my dad finds out, it's like, pull yourself up by your bootstraps. And so this allows people to experience walking and talking with a professionally trained therapist in a more normal or less clinical setting.
Okay, so I see also that you have therapy in a van. Now, I am heading on a road trip with my family, so I may need therapy in a van after I've had family in the car. Tell me about therapy in a van.
Well, several years ago, you know, Sprinter vans are like the hip thing in ski towns, you know?
Yeah,
it's
that's
like,
true.
oh my gosh, everybody's got Sprinter van envy because they're just a blast for bikes and traveling to the desert and the mountains. And so I thought, you know, why don't I should get a van. And then I've got, it serves three purposes. It's a roving billboard, because what I'm trying to do is destigmatize emotional care for active functional folks.
Yes.
So we should be at parties, at events, and instead of talking about, what are you training for? Are you still doing loaded jaw? Or, you know, you can say, hey, did you read the Trail Talks newsletter about anxiety? Man, that's really helpful. So I'm trying to really get people to kind of shift their thinking about it. So therapy on the fly, I call it, and it's actually it's an office inside. And it's so you open it up, and I mean it's therapy in itself. When people get in, it's like, oh, you're cured, because they're like, this is so cool. And just like when you're driving with your children, you know, it's like, again, intermittent eye contact, movement, and it allows people to speak and gain clarity over their feelings, you know. So when we're walking and talking, it decreases our emotional valence or intensity. And then when we're not so emotional about a topic, we can put on our thinking cap and we can think and feel at the same time.
Oh, that's wonderful.
Yeah.
Okay, well, I see something like being proactive. So for someone that, like a mother like me, and your kids have gone back to school, so now you actually have a little bit of time, what would being proactive look like?
Proactive is realizing that if you don't take care of yourself, you can't take care of anybody else. And as mothers, as fathers, single parents, you know, we're always putting everybody first, and we're not doing self-care. So self-care isn't just exercise. Self-care is about paying attention, and self-care equals self-love, kindness, and compassion. And really, we're the foundation of supporting other people. So we got to take care of ourselves. So carving out time to be quiet, making sure you're getting enough sleep. They're called functional boundaries or lifestyle habits. Really paying attention to those structural beams in our house. I use that particular metaphor. So, you know, you got to sleep, you got to eat well, you got to move, be outside, and you got to have unplugged time. You really need downtime. So when you go on this trip with your kids, you know, really everybody unplug, and it's incredibly refreshing.
Yes, I'm really excited. We're actually heading to Yellowstone for kind of a day. We're going to stay in Cody. Then we're heading over to Mount Rushmore. And so it's things that I've never been to Mount Rushmore, so I'm very excited. And actually, the kiddo's staying home.
Yeah. Oh.
But yeah, I don't know how I feel about that. But I'm going with my parents and my sister, and so it's exciting. And now that I've talked to you, I think maybe I'll use some of that. Maybe we can have a little family therapy.
And you know, and just pay attention to the relationship roles.
We're excited about that.
Who played the role?
What's
and just the family dance look like?
Yes, exactly, and just talking. Okay, well, we're about out of time, but I want people to know how to contact you.
Well,
do you have a website?
Yes,
okay.
It's trailtalk.com.
Oh, that's easy.
And we have Trail Talk Provo. We're just about to launch Trail Talk Heber Valley. Trail Talk
Oh,
Park
wow.
City.
Okay.
We have a branch called Trail Talk RX because
Okay.
I'm a nurse and a prescriber as well. And we're going to be launching Trail Talk Salt Lake City.
Wonderful. Well, that's a lot of options. Okay, well, thank you, Allison. We really appreciate you
Great.
being
Thanks for
here.
having me.
And we'll be right back.